Hi, Jackie. It's great to see you again. We
Yeah.
want to talk to a bunch of people about their reaction to this coronavirus. And you are of special interest because you are on the front lines. You are an infectious disease nurse working in Henry Ford Hospital in Detroit, and you're facing the worst of it. And could you just tell us a little bit about your job and what you're seeing at work?
hmm yeah. So like you said, I'm a registered nurse. My very first job has been infectious disease. That's where I started. That's where I still am. And um, the past, since it's been going on since about February, we've just been hearing about it. It's been more like rumor like, and it kind of swept over Michigan, especially Detroit, the city of Detroit, about a week and a half. I want to say just about 2 weeks ago, and the floor I work on was designated the COVID-19 floor. So my first day was last Thursday, and well, technically last Tuesday, but we really didn't have a lot of COVID patients yet. And it was really just a lot of chaos trying to prepare for kind of the swarm of patients that we knew were coming. And then last Thursday was my first day with real, like taking care. I knew I would be walking in to taking care of positive COVID patients.
Well, how did the hospital staff react? I mean, you said it was chaos, but was
I
there
mean,
fear? Or,
chaos in the best of terms.
yeah.
Normally, medicine is typically chaotic um, and intense, but it was more just, do we have the supplies we need? Where are the supplies that we need? Let's, turning all of our shared rooms into private rooms, making sure that everyone knew the resources that were available to them, making sure that policies were in place, that protocols were in place. Did everyone know how to take the gear off so that they didn't accidentally, like lots of little itty bitty things that you don't really think about until you're really presented them with them on like a large scale. Um,
Were
and
people afraid? Were they scared for their lives? I mean, hearing of all the deaths and the high rate of infection of
I think
medical workers.
at first it was kind of like people, I think there's always this level of excitement, which sounds really bad, but, or I don't know if it sounds bad, but I think like a lot of healthcare workers really love what they do. And there's this excitement to kind of jump into situations and scenarios and just take care of people and use the knowledge that we have to like push through. But walking in on like last week at the end of the week when it was really truly we were taking care of lots of rule outs, lots of positives, you could see the drain, like lots of people were drained at this point. They were physically, emotionally drained. And you could see kind of the, like a little bit of terror in people's faces. Like we are running out of supplies. We don't have masks to protect ourselves. Um, and I think that's why you see now, like a lot of hospitals are calling for donations and you see a lot of people on social media asking for masks and things because there's just isn't enough. And I think it's really scary as a healthcare worker to know that you're going to go in and take care of something that you're not protected from necessarily.
Did you have second thoughts about going to work?
Oh yeah. So I woke up on Thursday morning at like 4:30 in the morning and couldn't go back to sleep. And I just was laying there thinking, do I go? Do I not go? If I don't go, I'll never know what it's like. But if I do go, I could get sick or put myself in danger. But I still went, and I think like I just said I said a really long prayer before I went in, and I actually took like a video recording of myself before I went in to like calm myself down, like just talking to myself about like, okay, you're walking into this, you have absolutely no idea what you're walking into. Um, I remember saying like there's rumors that there's no PPE, but it's okay, or personal protective equipment. There's no equipment for you. And then I just kind of like sat there and said a not a long prayer, but like a prayer that God would get me through this day, and he would protect me, he would protect my patients, that I wouldn't make a mistake, and that I would just go home and I would be okay. And
So that must be ongoing. I'd like to pursue a little further, like the role of your faith in continuing to plan to work and take care of patients. I mean, how do you feel your faith plays in this being a frontline worker of this pandemic?
I think that my faith has always helped me in nursing. Thankfully, with my career and where I've chosen to work, I've never been asked to do anything that would misalign with my belief system. Now, that does exist in the healthcare industry, but I've never been asked to do something. Um, and so I think becoming a nurse and going through nursing school and actually working as a nurse, a lot of times has solidified my faith. Sometimes I find I talk more about my faith with my patients than I do on a normal day outside of the hospital, because most of the time these people, when they're sick, they want to hear words of encouragement. And especially in Detroit, there's a lot of very religious people in the city of Detroit. So they're happy to just talk about it regardless of exactly what you believe. But going in last week to work tested it a little bit. After working the 2 days, I was really it almost, I was very afraid that maybe I had gotten COVID, or it was just very terrifying. I'm gonna be honest. It was really scary, and kind of working in those conditions. And I think that my faith helped me, but it definitely was tested.
So
So
your faith was challenged,
mhm.
but do you think looking back now after being, through this for at least a week now, that it's changed you and your relationship with God at all?
I think it has definitely changed it a little bit. Like, I think it's just stronger now, or at least it's getting stronger. I think every day is a battle. Um, uh, our like our prayer life has definitely been strengthened, I believe. I think that as a married couple for 8 years now, it's, you know, you have prayer in your lives, you pray independently, you pray together, but that was probably something that we needed to work on. And so I think that that's definitely been stronger because we're relying more on each other as support. And so obviously, because, the foundation of our lives is God, that we then rely on God to support us. And so we've been praying a lot more and kind of turning to God's word more than maybe we were before, as a time in this time where we need comfort and we need that strength. And it also helps that the people in our lives are very strong in the word, and when we've turned to them, they've only turned to, giving us verses or telling us, hey, let's do the readings together, or let's say a prayer together. So I think turning to our other, brothers and sisters and or people that are in this together with us and believe the same thing as us, that they're there to help us too.
That's a great observation, because it's not just God directly. God works indirectly.
Mm-hmm.
Through our acquaintances as well.
Yeah. But I think that it's okay. Like, the one thing that I was trying to figure out over the weekend really was it's okay to be scared, because I was very scared, waiting kind of to see if I got a fever. And even today, I'm only day 4 after being exposed. So it's a very low exposure, but it's still exposure. And every day, monitoring my temperature and waiting to see if I have symptoms and waiting to see if I have a fever was really hard, because you're just basically sitting around waiting for a symptom that's kind of scary, that I think a lot of people have made to be very scary as well. And it's okay to be scared. And one of the things that I think that really just got me through the weekend, Saturday, Sunday, and the past couple of days, was just my trust that God will take care of me. I think that when you walk into something so unknown, I mean, we know nothing about this disease. We're only learning on the fly. It strips it down to that most basic level, that you just have to trust that God will take care of you. And
well, Jaclyn, that's it's a great work that you're doing. It's a great way to show our love for our neighbor, for people who have been infected and are truly suffering, that you face and you see at work. And it's a wonderful thing. And it's great to hear that you think that your faith is strengthening and your relation, your dependence on brothers and sisters is growing. Mm-hmm. And you know, it's my prayer that you continue to grow in faith, and God will certainly bless you for your efforts and what you're doing.
Thank
Well,
you.
thanks
Yeah.
so much, Jackie. Thanks for sharing your story, and let's keep in touch. Let's know how things proceed.
Yes, thank you so much for interviewing me, and I'm praying for everyone around the world. So
Great.
I'll stay safe.
Okay, thanks, Jackie.
Yeah.